it's so good to see so many familiar faces and friends. During the growth that I'm going to talk about with respect to Emergent, I don't always get to spend as much time in Lansing during the work week, and it's just great to be amongst friends. Glad to be here. Glad to talk to you about this, the Emergent story, which is really a story about saving lives, protecting lives, as well as the opioid epidemic. And so what we'd like to do, or what I'd like to do today, is walk you through some of the facts and figures, talk to you and educate you a bit about how this is impacting really every state and community in the country, and talk to you about what Emergent's doing as their part to serve those communities and serve those individuals and save lives. So in 2017, there were 70,237 deaths due to drug overdoses. And when you break that down a bit further, 47,600 deaths involved an opioid. Even further, kind of double clicking on the 47,000, 28,466 deaths were due to a synthetic opioid. It's a very complicated issue that requires a lot of time and a lot of attention and some focus. So let's talk about some of the trends. The purple line on the graph, from a data perspective, that's kind of, most of us probably heard about the opioid crisis in 2010. And in 2010, everybody recognized that purple line, which was prescription opioid deaths were rising. And in 2009-10, there was some public policy put in place that restricted the types of prescriptions and with some regulation. And you can see that little dip down in 2010. So we kind of curbed, I'll call it, the prescription deaths in 2010. But I think one of the things that happened almost simultaneously with that is the orange or yellow line there starts to increase quite rapidly. So those are the deaths related to heroin use. So as you can, if you look across the geography, this isn't an inner city problem. This is an every state, every community problem. And in many cases, it's probably touched, it was already mentioned earlier, many of us from a personal perspective, either a family member, a friend, or in our community. And so it's going to take more than Narcan, a lot of different things from a federal, local, and state perspective to drive change and get our arms around this problem. Turning the tables from kind of lives lost and deaths, which is, I think, pretty heady, to the costs of this type of a crisis. So it's been estimated that since 2001 through 2016 that we've spent as a nation over $1 trillion to try to battle this epidemic. And it's projected that we're going to spend another $500 billion between 2016 and 2020. And as you can see here, the costs aren't going down. When it comes to opioid overdose, probably the most important message is response time matters. Seconds count. We talk a lot about internally every second counts. Permanent brain damage begins after only 4 minutes without oxygen, and death can occur as soon as 4 to 6 minutes later. So time matters. And then when you talk about carfentanil, which is kind of the most recent kind of concern and challenge, carfentanil is 10,000 times more potent than morphine. And so a fatal dose is kind of represented on that penny down there. So one of the things, I'm a visual person, but one of the best ways this has been described to me is if you got your coffee this morning, and I'm a coffee person, so I don't put sugar in it, but I grabbed a packet this morning. This packet of sugar or Splenda, just as a quantity, would be 50,000 lethal doses of carfentanil. We're super concerned about the opioid epidemic and its enormous personal and economic costs. Lastly, we will always be guided in all of our endeavors by our mission to protect and enhance lives. So with that, thank you very much for your time and attention. It was a pleasure to talk here today, and we'll open it up for questions.